Hi there, it's Tammy here. And in this short video, I'm going to talk about a disconnect that I believe exists between advice being given to pregnant women experiencing pelvic girdle pain to stop exercising and the reality that training can actually help ease their symptoms or even stop it from developing in the first place. So if you're concerned that pelvic girdle pain is going to hinder your pregnancy training or exercise journey, then this video is absolutely for you. And the main reason why I decided to make this video is because a coach recently reached out to me asking about some advice that was given to a pregnant client of theirs regarding pelvic girdle pain by this pregnant woman's healthcare provider. Now, before I start this video, I think it's really important to note that I don't actually know this pregnant woman. I don't know her training history. All that I know is that she's pretty early in her pregnancy, but I also know her coach, right? So based on what I know of her coach, I'm pretty sure that she's been following a structured strength training program that would be correctly progressed and sequenced, right? So this coach's pregnant client, messaged him with the following, right? I have some bad news. I saw the doctor and I have pelvic girdle pain. I have some weird twinges on one side that have gotten worse recently, right? Nothing that I've done in training, just as a result of my changing body. So she said that I can't do weight training because it's too risky, that it will get worse. She said I need to stick to Pilates, walking, swimming, and yoga. So I'll have to stop our sessions, right? Now, there is a lot that I have to say about this, mostly though about the disconnect between the advice being given to this pregnant woman around stopping strength training and the reality that strength training during pregnancy is not only recommended, but I believe it's a crucial element to the overall health and well-being of both the mother and the baby, and her baby, right? But let me start with saying that I respect healthcare providers immensely, right? However, I do believe that this particular advice was incomplete. And it's important to understand that we can't actually blame the healthcare providers for this, right? Because the reality is you only really see your healthcare provider for a limited amount of time at your scheduled visits, which, if you're lucky, would be every, say, 4 weeks, maybe from 12 to 28 weeks, and then increasing in frequency as you get closer to your birth. Now, within these particular visits, there's so much information specific to you and your baby's immediate health and well-being that your healthcare provider absolutely needs to prioritize the information that they deliver. Studies have even shown that time constraints are the biggest barrier preventing healthcare providers from discussing exercise with their pregnant patients. And it's quite possible, in my eyes, that the vast amount of information that needs to be covered when discussing exercise during pregnancy just adds to this kind of lack of time feeling that the healthcare providers are experiencing. But even when taking this lack of time kind of feeling into consideration, we can't actually ignore the research, which shows the information given by healthcare providers around pregnancy exercise is often incomplete or inconsistent. Case in point, this healthcare provider telling a pregnant woman to stop strength training because she's had some weird twinges on one side that have gotten worse recently, and that she can't do weight training as it's too risky, that it will get worse. Now, as a strength coach with demonstrated knowledge and over a decade's experience working with the pregnant and postnatal population, in my opinion, the advice given needed to be much more specific, because the reality is, while incorrectly weight training can absolutely aggravate pelvic girdle pain, correct exercise selection and specialized guidance would actually likely strengthen the muscles surrounding the pelvis and provide extra strength and support to this area, therefore minimizing the effects of the pelvic girdle pain. Now, the flip side of that is a complete lack of strength training in someone whose body is used to strength training could actually lead to the pelvic girdle pain worsening. Now, to understand why, you first need to understand that pelvic girdle pain happens when the pelvis, which is essentially the biggest joint in the entire body, right? What happens is that joint becomes unstable, leading to too much movement, which is what causes the pain, or in this person's experience, weird twinges, right? So by stopping strength training, the muscles surrounding the pelvis are actually going to start weakening. And how quickly this happens will obviously depend on how long the person's been training for. But on average, it takes anywhere from 2 to 4 weeks for muscles to start weakening due to inactivity. So when the muscles surrounding the pelvis slowly start to weaken, this actually creates even more instability in the pelvis. Yet when a joint is unstable, leading to pain, what you actually want to do is strengthen the muscles, the ligaments, and the tendons surrounding the joint to help stabilize it, right? And this is essentially what strength training would be doing. Now, of course, exercise selection is crucial in this case because incorrect exercise selection could very well aggravate pelvic girdle pain terribly. But the thing is, this is where specialist knowledge comes in. And again, in my opinion, while walking, swimming, Pilates, and yoga could actually be very good alternatives, like strength training, they also have the capacity to aggravate the pelvic girdle pain just as much as strength training, even more if they're not done under the guidance of someone experienced in this area. And I'm talking about kind of yoga and Pilates here, not walking or swimming, right? You don't need specialist guidance for that. But the thing is that each of these activities still has movement through the pelvis, and lack of support and strength from the muscles surrounding the pelvis, combined with anything where there's a transference of load from one side of the pelvis to the other, like walking, right, can actually aggravate pelvic girdle pain. And the advice to walk is a perfect example of this because I've actually had clients with debilitating pelvic girdle pain that was caused by, you guessed it, too much walking, right? So given the importance of strength training during pregnancy and its long-reaching positive benefits, it's clear to me that there's a disconnect in the care provided to the pregnant population, which is why so many women stop training altogether, or they just walk, or, they turn to Dr. Google. From my perspective, there are so many interconnected aspects to training during pregnancy. I think the question that we should all be asking is, why is this falling onto the healthcare providers' shoulders in the first place? They are healthcare providers, they are obstetricians, they're midwives, they're doctors. They specialize in safely delivering your baby. They are not pregnancy and postnatal specialist strength coaches. They don't specialize in safe exercise prescription during pregnancy or the postnatal journey. And the question is, would you want me, a pregnancy and postnatal specialist strength coach, delivering your baby? Or would you prefer, your healthcare provider who, depending on their qualifications, has likely spent up to 12 years studying to become specialized in their field to do it, right? But if we flip that around and think about it in the other perspective, would you want your healthcare provider who specializes in delivering your baby to program your strength training? Right? Or would you want someone like me who spent over a decade providing individualized exercise prescription to the pregnant and postnatal population, providing your strength training programs and guiding your pregnancy exercise and health and well-being journey? In my opinion, a better way to approach this would have been to refer her onto a specialist pelvic physio to assess exactly what's been causing the weird twinge on one side that seems to have gotten worse. Now, the physio could have then liaised with the strength coach and advised them on what they can and can't do, provided that they are obviously certified to train pregnant women, right? Or the strength coach could have referred her on to a specialist like me. And I think the most important thing to remember here is that people train for all different reasons, right? Some of which is mental health. You know, they train to feel good, they enjoy it. And we can't forget all of the kind of thoughts and emotions that can come up during a woman's maternal metamorphosis, which training can definitely help with, along with how she feels about her ever-changing body, which during pregnancy can be quite conflicting for some women. So telling a pregnant woman who strength trains regularly that she can't do this can actually have a flow-on effect to how she feels during her pregnancy, not only physically, but mentally and emotionally as well. And this can then in turn flow onto her postpartum period, a time where strength is so important to her overall health and well-being, right? And I'm going to conclude this really short video by saying that during pregnancy, unless you're experiencing something where exercise is specifically contraindicated, there is no reason for you to stop strength training. But my advice to you would be to train with a specialist who has demonstrated knowledge and the ability to adjust and adapt any exercises to suit you throughout your entire pregnancy journey. Because the reality is, like this woman's found out, things just pop up during your pregnancy that can affect your ability to train in exactly the same way that you were previously. And having ongoing access to someone who can guide you along this journey, not only with your training, but in the other core pillars of your health and well-being during this hugely transformative time, can actually likely make a hugely positive impact to your pregnancy and your postnatal experience. So if that sounds like the kind of pregnancy journey that you would like to experience, as opposed to one that, you know, tells you to stop strength training, feel free to head to the link in my bio or my video description and apply to join my complimentary but private community. So that's it from me today. I hope this video helps, and I'll see you in the next one.